Hey guys, this is Dr. Denny Warren with Generations Health and Wellness Center, and I want to share with you what we call the correction of the month. See, in our office what we do is we evaluate patients when they first come in, and oftentimes we'll actually take x-rays to get a baseline of the health of their spine, and then under a series of adjustments after that, down the road we'll take post x-rays. Usually it'll take around 6 months and around 12 months. And a good way of thinking of it is think of the type of work that we do like an orthodontist does. They will correct the alignment of your teeth to restore everything back to the proper alignment. Well, as a chiropractor, due to different traumas people have had, it could be sudden like a motor vehicle accident or a sports injury or a slip or fall, or it could be something like sitting with poor posture, their head forward and their shoulders forward every single day for hours on end. That can cause trauma to their spine and cause their spine to literally start to collapse and rot and degenerate. So as a chiropractor, my goal is to help bring back the proper posture, bring back that proper alignment, but it's something that takes time to do. So I want to tell you about this patient that came in. She is 67 years old. She's a retired nurse, and she said for the last half of her career, she had a limp. She was always walking with a limp. And she started to develop this pain that was radiating down the side of her leg. And so what we did is we took our first x-ray. You can take a look at this here. This one over here is the first x-ray that we took. When you look, this is looking front to back of someone's low back. The hips are supposed to be level right along this line here. And you can see that's almost a 3 centimeter difference in the level of her hips. And the spine is supposed to be straight up and down, but you can see that the curvature here is at 9.6 degrees. Just so you know, a 10-degree curvature and anything worse than that is considered scoliosis. So she's right on the edge of scoliosis. So if you think about that and think about that hip pain and think about the pain radiating down to her legs and think about the limp that she had. Of course she had a limp because of that difference there. Of course she had the pain because that muscle imbalance. When you look at that x-ray, you can tell there's muscle imbalance. This is what we did here. Take a look at this x-ray. This was a year later. It took 1 year, but take a look. Hips are almost perfectly level, and the spine is almost perfectly straight up and down. Guess what? No more limp, no more low back pain, no more pain radiating down to her legs. She actually lives out close to Beaver Lake, and so her backyard goes down, slopes down big time, and she's a very active lady. She likes to go out and weed eat, where she has one leg hacked up high on the side of the hillside, the other leg down, where she's weed eating the entire hillside. And she said used to that, doing that weed eating job and also walking would cause so much pain she'd be out for several days, if not a week after that. She has no problem at all with that. So the alignment and stability in your spine matters as far as quality of life. And so we want to help you evaluate your quality of life, evaluate the quality of health of your spine. So if you have any questions about this, or if you're interested to see what your spine actually looks like, call our office. We can get you set up for an appointment. But I hope this helps, and this was an awesome, awesome correction of the month. Have a great day, and we'll see you in the next video.